Hi everyone! Today, we're diving into a fundamental concept in healthcare that's absolutely vital: clinical correlation. It might sound like a big medical term, but it's really about piecing together a health puzzle. So, what exactly is clinical correlation? Simply put, it's the process of connecting all the different pieces of information about a patient to form a complete and meaningful picture. Think of a skilled detective gathering clues and understanding how they all fit together. In medicine, these crucial clues are things like a patient's reported symptoms, what they feel and tell their doctor. They also include physical exam findings, what the doctor observes, touches, or listens to. Then there are objective data points like lab test results, detailed imaging scans such as X-rays, CTs, or MRIs, and even the patient's complete medical history and lifestyle factors. All these individual pieces of data need to be looked at together, not in isolation. Why is this process so incredibly important in healthcare? Clinical correlation is essential for several key reasons. First, it helps doctors make accurate diagnoses. Without it, a diagnosis might be incomplete or even incorrect. Second, it guides healthcare professionals to develop the most effective and personalized treatment plans for each patient. Third, and critically, it ensures that healthcare providers don't just treat a single abnormal lab number or a lone symptom. Instead, they treat the whole person, taking into account their unique circumstances. For instance, imagine a patient comes into the emergency room complaining of severe chest pain. An EKG might show certain characteristic changes, and a subsequent blood test might reveal elevated cardiac enzymes. A skilled doctor doesn't just look at each of these findings individually. They correlate the patient's specific type of chest pain, the EKG changes, the elevated blood markers, and the patient's age, risk factors, and medical history to confidently diagnose something like a heart attack. This holistic view ensures the right treatment is started immediately. Another common example: a child has a high fever and a distinctive rash. The pediatrician examines them, observes specific spots in their throat, and a rapid strep test comes back positive. The doctor correlates the fever, the specific rash, the throat findings, and the positive test result to make a confident diagnosis of strep throat, allowing for appropriate antibiotic treatment. Without this critical correlation, healthcare would be fragmented, less precise, and ultimately less effective. It's about applying critical thinking and clinical judgment to all available information. Every doctor, nurse, physician assistant, and medical student uses clinical correlation daily. It helps them understand the why behind a patient's condition, not just the what, leading to better patient outcomes and more personalized, compassionate care. Thank you so much for watching and taking the time to learn about clinical correlation with me today. If you found this explanation clear and helpful, please consider giving this video a big thumbs up, sharing it with anyone who might benefit, and subscribing to the channel for more educational content like this. Your support truly helps us grow and continue creating valuable resources. We deeply appreciate it.